So let's imagine you're an adult person that is having a lot of anxiety and maybe even panic disorder symptoms, such as hyperventilation, shakes, feeling like you're going to have a heart attack. Kind of common panic disorder symptoms when you're, let's say, driving over a bridge or flying in a plane or any other kind of a mode of transportation where it feels like you're not in control of what's about to happen. Some of the ways I would work with someone like that is, besides identifying what their beliefs are about doing those things and how they're getting in the way, and kind of helping them see what they believe to be more realistic about that and what they believe is irrational about those beliefs. Because even if you're having those panic disorders, and most clients experience this, they're aware that the belief system is distorted. It's not like they're thinking they know that there's something wrong with them. And they want to just kind of feel better and get over it and get back to, quote, normal. So one of the things I introduce for high anxiety folks that have panic symptoms is what's known as a pelvic floor exercise. In our brain, we have a spinal cord that goes up to our brains, and we have what's called the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is responsible for the autonomic responses that are like panic and anxiety and the sweats and the stuff that makes the symptoms that creates a feeling like the person's not safe. That is the sympathetic nervous system. And then the parasympathetic nervous system is when the person feels calm, relaxed, clear-minded. The goal, obviously, is to have the parasympathetic nervous system in control, but the sympathetic nervous system kind of irrationally takes over. So one of the techniques in how to switch that back to that calming state or the parasympathetic nervous system, believe it or not, is pelvic floor exercises. Inside of the rectal area, we have a muscle that's called the sphincter muscle. And the sphincter muscle is connected to your spinal cord, and it goes up into the brain. What I would do with a client is I would help them identify where that muscle is through like a plane. Like, for example, I would have them sit on their fists and squeeze their butt cheeks. And then I would have them push in with their hips hard so that there's sort of like an imaginary box. And inside the middle of the box is the sphincter muscle. And if I'm going to be blunt with you, the sphincter muscle is the one that you use to poop. The ability to be able to contract and relax that can actually work wonders in helping to calm someone with panic symptoms. So I would talk about that and have them try it. I also have a handout on that so that they could practice that at home. I was like, let's look at what is anxiety. Anxiety is like a warning sign that some unknown danger is about to happen. That doesn't mean it's rational, but that's the process, right? So by calming your nervous system overall through that method, it sort of says, okay, you know what, I'm safe here. And the best part about the sphincter muscle exercise, that's not what it's called, but we'll call it that, no one knows you're doing it. No one can see it. You're not going to have any kind of silly facial expression, or, well, hopefully not, on your face while you're doing it. And even while sitting in a car, sitting in an airplane or a train, or even a social situation that you're nervous about, if you were to relax that muscle, that will help with that transition from the fight or flight response into a more relaxed state.